Hello and welcome to the Food as Medicine Show with Dr. Ann, the place to be for real talk with real people and real results so that you can heal yourself naturally. I'm your host, Dr. Ann, and I'm a board-certified pharmacist and health coach specializing in treating cholesterol without medications. You can learn more about me at drann.com, spelled A-N-H, as in hieroglyphics. I want to let you know that the opinions expressed on this show may not represent my opinions, and the show is for general information only, not a substitute for medical care. So prior to beginning any new health program, I recommend that you consult with a qualified health professional. In today's episode, I chat with Dr. V, who has over 30 years of experience as a chiropractor who conquered breast cancer in both 2004 and 2006 using only 100% natural treatment methods. It is her mission to teach people about how simple it is to heal your body from cancer and to empower women to learn about alternative breast cancer therapies and inspire them to be proactive about prevention. In today's show, Dr. V and I chat about the 7 essentials for healing and preventing breast cancer, what foods to avoid and what foods to enjoy to starve cancer cells, whether she prefers juicing or blending, which 2 small lifestyle changes that will give you the biggest bang for your buck when starting a healthy lifestyle to prevent breast cancer, and how to overcome specific food cravings, and so much more. All right, let's go chat with Dr. V. Hi, and welcome back to the Food as Medicine Show with Dr. Ann. Today I have the honor of interviewing Dr. V, an incredible woman who had to face the diagnosis of breast cancer and embarked on a journey of research, discovery, and personal transformation in order to heal herself. Dr. V, thanks so much for taking the time to speak with me today. Why don't we start by having you tell us a little bit more about yourself and what you do?
Well, thanks so much for having me, Ann. This is a real privilege. I'm really excited to be able to share my message. Well, basically, what do? I help people to understand the relationship between breast cancer and their overall health. My passion is to be able to empower women about alternative breast cancer therapies and to inspire them to be proactive about prevention when it comes to breast cancer. I've been in the wellness industry for well over 30 years, and that's always been a passion of mine to be able to help sick people get well. I came through that when I was 16 years old, and I was turned on to chiropractic and better nutrition. Since that time, I graduated as a chiropractor. I've been in active practice for over 30 years. The last few years I've been, quote-unquote, retired from my practice, but I decided that it was time to share my story about being a breast cancer conqueror, and that's what I do now. I help people understand how important it is and how simple it really is to be able to heal their body from cancer.
Interesting. So I guess if you don't mind, if you want to tell us a little bit more about your journey with breast cancer, because from what I understand, you didn't really have a traditional course. Like you didn't choose a traditional course of therapy. Is that right?
Correct. And for me, finding out that I had breast cancer, well, like most women probably, it was a big shock because I was super doc and super healthy, so I thought I'd done everything right. You know, I was under chiropractic care. I ate organically before organic was even in style. In my practice, I had seen many patients who had done the traditional cancer therapies with very less than desirable outcomes, let's say. They had a lot of side effects. And I saw them suffer. My mother herself had breast cancer, had so much radiation to the breast that it blistered, and it was red hot and hard for over a year. My father died of pancreatic cancer, so I didn't have much hope or much trust in the medical system when it came to cancer. And then on the flip side, in my practice, I'd also seen patients who had chosen more natural, more gentler routes when it came to healing cancer, and I was very impressed with how they fared and the results that I saw there. So I always knew that I would definitely choose the more natural route. So what I chose to do was to affect the cancer both internally and externally. Internally, I obviously was very careful about my diet, did extra juicing, fasting, cleansing, several homeopathic remedies and nutrients. On the outside, externally, I chose to apply something called a black salve, which is basically made from the plant bloodroot. And in the bloodroot, there's a chemical, a plant chemical called sanguinarine, and that particular phytochemical or plant chemical literally kills cancer cells. And so when you apply this paste to the superficial tumor, it actually destroys the tumor, and the tumor is expelled from the body. So I applied that in 2004, and I documented everything, took pictures, because I knew that one day I wanted to be able to share this with other women if they chose to go that route. When the tumor fell out in 2004, there was still some unhealthy tissue, so I chose to just let it heal, and I monitored everything through thermography and different bioenergetic testing. I kept working on my health, different emotional issues, and then 2006, it became apparent that I had to do it again, so I applied the paste again in 2006 with much better results this time, and I've been perfectly healthy and clear since 2006.
Wow. Okay. Wow. That's incredible. So this might be a silly question. You said the tumor was expelled from your body? Like, did it just fall out? Like, what does that mean?
I know it sounds a little silly, but yes. And there's actually on the website there's a YouTube video where you can see the process. Literally, the bloodroot kills the cancer cells. So, think of it when you have a splinter, how it, becomes inflamed and your body, eventually wants to push that little splinter out. Well, the body then recognizes this tumor as a dying piece of tissue, basically, and it wants to expel it. And so there's a process that it goes through, and it usually takes about 4 to 6 weeks. And literally, there's a separation that occurs, and the tumor literally falls out. And I've got documented pictures, and I've seen many patients use that process as well. And it's been used. This type of treatment has been used for literally hundreds and hundreds of years. There was actually a medical doctor called Dr. Mose who treated over 12,000 successful cancer patients with this type of treatment, and he had a book out in the 1950s that documented all the results that he had. So it's a very safe procedure. You have to be prepared and aware and really educate yourself about the procedure, and it's something that you don't take lightly. You definitely need the help of a good coach or a physician that knows what they're doing.
Yeah. So can you briefly talk about why you made that decision between, okay, I'm going to choose a different route to treat my cancer?
Well, in my practice, I had seen so many patients who had gone the traditional route with with less than desirable results. I mean, we all know that the chemotherapy is toxic and it's poisonous and there's got horrible side effects. We know that radiation is bad for you, no matter, how little amount it is. And so when you do the radiation, the chemo, and oftentimes the surgery, then it leaves the body very weakened. My mother herself had breast cancer, and I saw her go through the traditional route. She had the lumpectomy and the radiation to the breast to the point where it blistered and it caused some severe burning and redness for over a year. So I knew that when I was going to, if ever I was going to work with cancer personally, that I would certainly choose a milder, more gentler approach. And I've seen many patients choose that approach with very successful outcomes, very few side effects, and it just makes sense because cancer is a symptom. Cancer is simply a symptom that your body is not healthy, and in order to heal the body, it makes sense to give it what it needs, detox, build the immune system, and allow the body to do what it does best, and that's heal. It doesn't really make sense to give poison and toxins and radiate a body that's already very fatigued and sick in the first place.
Yeah. So did you, through the course of your treatment, did you only go a route with the salve and the non-traditional route, or did you also mix it with some traditional Western medicine as well?
No, I did not use any of the methods. I did 100% natural, and I chose not to go the other route. In saying that, for your audience or women who may hear this, I want to be perfectly clear that I honor and respect all types of treatment methods. Whatever a woman chooses, that's what she feels is best for her, then I honor her and respect her for that. So the point of all this is not to tell people they're wrong about doing a certain kind of treatment, but just simply educating them that there are options, there are other choices. And when you look at things statistically, for example, when it comes to chemotherapy, there was a study done in Australia that showed a 5-year survival rate with several different types of cancers using chemotherapy alone was only a 2% survival rate after 5 years. Now, those aren't very good statistics.
No.
So the important thing is to definitely educate yourself. Knowledge is power. There's so much information on the Internet and so much available for you. Make an informed decision as to what kind of treatment option is best for you.
Mhm. Wow. So it sounds like, you're kind of putting together like a movement because you've conquered breast cancer and you really want to inspire women to be proactive with prevention. And it's interesting that you say that cancer is a symptom of your body. Can you tell us about that philosophy and how you came to that decision?
Well, I saw there was such a need for women to be educated. It just really breaks my heart and really saddens me when I see women that are diagnosed with breast cancer, and the first thing that they want to think about is, having their breasts cut off, or taking more poison, or they're at such the mercy of the medical industry, and it's so important for them to be able to take off the blinders, so to speak, and to be able to look outside the box. And there's movements called breast cancer survivor movement, the pink ribbon movement. Well, I chose a different word. I chose conqueror because for me it had more to do with being proactive, being in charge, and really conquering. If you're just surviving, you're barely getting by. You're barely surviving the treatment methods, so to speak. But when you're a conqueror, you've been more proactive. You've made informed decisions, and you know that you're in charge of your body and you're in charge of this cancer, and you can conquer and be the victor on the other side.
Wow, that's a totally different way to look at it. And, it's so empowering because, like you said, when people get that diagnosis of cancer, it's almost where you get to the point where you're just locked into this mode of there's only one option. And I like the fact that you present, there might be another option.
Absolutely.
So then, can you tell us more about, some of the main points that you teach people about in terms of prevention and the methods that you use to help them conquer any, the cancers that they're facing?
Absolutely. When it comes down to it, there's basically 7 simple steps, and I call these the 7 essentials for healing and preventing breast cancer. So the first one has to do with food. It's called Let Food Be Your Medicine, and I'm sure we can talk a little bit more about this because food is your specialty. But,
it's my obsession.
Your obsession. I understand that. There's so many things when it comes to food. Things that you need to avoid and things that you can enjoy. The essential number 2 has to do with reducing or eliminating your toxic exposure. There was a study done recently by the Environmental Working Group where they studied the umbilical cord blood of 10 infants in America, in different places in North America, and they discovered over 287 foreign chemicals in the umbilical cord blood, which meant they were in the mother, but unfortunately the child was inheriting all these chemicals as well. So when you think about all the chemicals that we're exposed to every day, the average person starts their day with toxins in their mouth by brushing their teeth with a toxic toothpaste, to the hair care products, to the skin products, to the makeup, to the food they eat. I mean, there's so many toxins, and there's so many ways to reduce that. So again, it's about education. Essential number 3 has to do with balancing your energy, and here I discuss learning how to balance your hormones. Exercise is so important. Chiropractic, different energy modalities like Reiki or massage, yoga. Sunshine is so important to balance your energy. Essential number 4 has to do with healing the emotional hurts. There's so much research that tells us that stress is inducing over 80 to 90% of diseases and illnesses, and cancer is certainly one of them. So it's learning how to heal the emotions and to be more proactive about being in charge of your emotions. Essential number 5 has to do with embracing biological dentistry. Now, the average dentist is going to put very toxic materials in your mouth, such as mercury. Mercury is the most toxic natural substance on the planet, yet they put it in your mouth telling you that it's perfectly safe. Well, a lot of research, a lot of documentation shows us that these things are very toxic. Your body does not handle heavy metals. And so it's important, if you want to heal from breast cancer or any type of illness for that matter, you want to eliminate those toxins in your mouth and have them replaced with more biocompatible materials. Essential number 6 has to do with rejuvenating your body with therapeutic plants, and that has to do with the hundreds of known cancer cures that are herbal in nature. And again, that's a whole topic unto itself. Bloodroot is one of them, chaga. The list goes on. And the last but not least, which is I'm very passionate about, is number 7, is adopting very early detection with thermography. Breast thermography basically is a non-invasive, non-painful, radiation-free way of detecting unhealthy tissue and physiological changes going on in the breast. Thermography can detect tumors in the breast 5 to 8 years before they can be detected on a mammogram. So it's a wonderful tool to use in conjunction with mammograms if you so choose, or just thermography by itself. So those are basically the 7 essentials that will help you heal and prevent breast cancer.
Wow. So I guess before we dive into the 7 essentials, I'm curious about how did you develop these? Like, how did you come to these being the 7 steps that are important for whole body health and well-being?
Well, you have to approach your health in a, quote-unquote, holistic way. Your body is not just one entity. It's comprised of many entities, the physical, the spiritual, the emotional, and you have to kind of unpeel the layers. Think of it like an onion. You want to peel the layers and get to the core. And so each of these essentials affects and touches a specific aspect that is needed for proper healing. And in my 30-plus years in active practice, I realized that there's so many different aspects that need to be that need to be touched, so to speak, in order to be able to bring the quickest and the best resolution. Because if you, let's say you just change your diet, but you don't exercise, or you don't deal with your emotional issues, and you keep those heavy metals in your mouth, those amalgams and root canals, your chances of surviving or healing may not be as good if you also added those other things. So each step just brings you a little bit closer to eliminating the cause and just being a healthier person in general.
Mm-hmm. So basically, it's just the best of all you've learned in your 30 years of practice.
That's a good conclusion, yes.
Yeah. Well, and I have to say, if someone looked at a picture of you, Dr. V, I would not have known that you've been in practice that long. You look wonderful, by the way.
Well, thank you.
So when I read that in your bio, I was like, are you kidding me? What? So, you've done really well for yourself in keeping yourself healthy, and congratulations again on conquering breast cancer, because that's a feat in itself. And to look so good after all of that, that you went through is just amazing.
Well, thank you, Anne. That's very sweet.
Maybe if you wanted to talk a little bit more about each essential and why you think they're important and what the essential is about.
Okay, very good. So essential number 1 has to do with let food be your medicine. And we can spend a little bit of time on this because I know, how important food is for you. First thing I tell my patients or my clients is they have to learn how to avoid certain things. So anything that's refined and processed, if it doesn't come from the earth, don't put it in your body. Anything that's white, so think of white rice, white pasta, white bread, sugar. Cancer feeds on sugar, and anything that's white and processed is going to feed your cancer. So if you want to feed the cancer, eat sugar. If you want to starve your cancer, sugar is a great place to start by eliminating it. You want to also avoid unhealthy oils, such as hydrogenated fats and oils, specific oils that are really high in linoleic acid, for example, tend to be things that you want to avoid. Obviously, you want to avoid tap water, which has hundreds of chemicals in it. Canned foods, meats that have growth hormones in them, any types of processed meats, hydrogenated and pasteurized dairy products that also have hormones in them, and anything that basically comes out of a can is dead, so you want to avoid that as well. So there's a lot of things that you need to avoid initially. So then you ask yourself, okay, well, if I eliminate all those things, then what can I eat? So that's where we have the enjoy food. So everything that's organic, all organic vegetables. You want to be able to focus a little bit more on the low glycemic fruits because, again, even though it's a natural sugar, sugars do feed cancer. So you can use things like blueberries and raspberries. The one first slips my mind here, but green apples, those are more low glycemic. You can also start juicing several of your vegetables and your limited amount of fruits. But my preference to juicing is blending. Now, blending has to do with using a high-powered blender in which you put all kinds of vegetables such as kale and celery and broccoli sprouts. You can add things like spirulina, fish oil, flaxseed oil, and you blend all that together. And there's many benefits to that because research has shown that it doesn't oxidize as quickly, so the nutrients are actually more bioavailable. And then you have the added benefit of the fiber, which you don't have with juicing. You have the soluble and insoluble fiber. So the soluble fiber is what gets through the arteries and cleans out the bad cholesterols. The insoluble fiber is what's going to help with the bowels and cleaning the colon.
Yep, so it's a natural way of cleansing out your insides by doing blending. Mm-hmm.
The blending, right? The green drinks, green smoothies, basically. And then you can also add to that list of being able to enjoy foods. Every kind of vegetable imaginable. You can also drink several types of different herb teas, such as Essiac tea. Essiac tea is basically a tea that has helped thousands and thousands of people overcome cancer. There's different types of detox teas that you can drink. Green tea, which is very beneficial as well. It has many phytochemicals in there that have been shown to improve cancer or decrease cancer in the body. You can also do raw almonds and raw walnuts, which are beneficial. And basically, when I work with patients, I recommend that 80% of their diet is raw while they're trying to heal from cancer. Some people do want a certain amount of protein, depending on their blood type. If they do want to add protein, only grass-fed 100% organic beef, free-range chickens and eggs. Making sure that your diet is very alkaline. That's very, very important because cancer grows in a very acidic environment, and tumors by nature are very acidic themselves, and they give off a lot of lactic acids. So your blood pH is about 7.4, which is a little bit on the alkaline side. So if you eat foods that are more alkaline, such as raw fruits, vegetables, and greens, it's going to have a tendency to keep your blood pH more alkaline, which, again, discourages unhealthy pathogens from growing in the body.
Okay. So, I really like also the fact that you call them enjoy foods because, when you think about foods to avoid, it's a really negative term, and it for someone who is, for me, starting to incorporate a healthier lifestyle, it just was almost depressing, like there's so many foods I can't eat. But then when you phrase it, these are the foods you can enjoy, it makes it just a different perspective. So
correct.
I like that.
Correct.
Okay, so so you talked about, things that that might not be good for cancer and then things that might be helpful for cancer. And you mentioned a tea. What was that tea again that you said thousands of cancer patients have used that has helped them?
Essiac tea. It's ESS as in Sam, IAC as in cat, Essiac tea. And the best source of Essiac tea is to be found in Canada. So if you do essiacteacanada.com, that's the best source of it. The original formula was developed by a Canadian nurse back in the 50s. Her name is Casey, and this is just her name spelled backwards. But she had a special formula. Literally hundreds of patients would come to her clinic every day with amazing results. And this formula has been passed down to a company in Canada when she passed away. So.
Oh, okay. So you're talking about food and how food is medicine. So what is really, if someone wanted to start changing their diet into a more healthier lifestyle, what are some of the first steps that you would recommend they do that would give them, so to speak, like the best bang for their buck to make the changes right away?
Several things. First of all, I think, water. Water is a very simple thing. There are many different kinds of water, but water would help detoxify and carry a lot of toxins out of the body and, help with the pH balance. For people who don't drink enough water, sometimes even going to 64 ounces of water is a big change for them. So just, starting off there, if you can start drinking more water. And there's a research now that has shown us that there's a type of water which is extremely beneficial for hydration and detoxification, and that's a single file alignment water, SFA, where basically, we're born with water that is single structured, aligned, and as we age, we have an increasingly amount of difficulty in converting regular water into single file alignment, because if you think of your cells, they have little holes in them or little pores. We call them aquaporins, and water can get through there one single cell at a time, file alignment, but if it's clustered and unhealthy water, it's hard for that water to get into the cell. There was some research done by a Nobel Prize winner, Dr. Peter Auger, and he's actually a Nobel Prize winner, and he showed that this single file structure is really the best way to hydrate the body. And you can find some of this information on our website as to, how to get this single file alignment water. If that's not available to you, spring water or purified water are the next best steps.
Would using a Brita filter help? The one that you kind of attach to your faucet?
No. I mean, that's a step in the right direction. It takes away the chlorine and a few little, chemicals. But if you're going to get serious about your health, you need to invest in a real water filter. One of the best water filters can be found online. It's called Aquasana. AQUASANA, aquasana.com, and it's a company out of California, very reasonably priced. For $140, you can get a good filtration system that you change the filters every 6 months, and it takes out 99.9% of the impurities of the water.
Okay. Great. I'll have to look into that.
Okay.
Because I'm using a Brita filter now, and the water does not taste very good.
No. Yeah, don't use Brita. I mean, it's a great. They've got a great advertising plan out there to convince people, but it's no, you don't want to use Brita.
Well, the more I drink water and from that filter, the more my throat gets dry. So I'm like, I don't think this is working, because if I'm drinking more, I shouldn't feel more thirsty. So. Exactly.
Which is why it's so important to look into the better types of waters, and the single file alignment water is also very good.
Mm-hmm. Okay, so first step would be just increasing your water intake, and then increasing the quality of the water that you're taking in.
Correct.
As a first step for improving your health. What other small changes could people make that will help them see an immediate benefit?
Start eating a big salad every day. And that means everything organic, but throw in some spinach and some kale and some romaine lettuce, and then add carrots and red and yellow peppers, parsley, sprouts, raw sunflower seeds or raw almonds on top of that. And just make a very plain dressing with olive oil and apple cider vinegar with a few little spices in there, and that's a great place to start. And just being conscious of what you're putting in your body. So before you put something in the body, just ask yourself, is this going to help or is this going to hinder my health? And it's as simple as that.
So then I guess another quick question would be, if someone had cravings, right, how would they deal with that? The salty or the sweet or the crunchy. I found as I'm eating healthier, I'm having less and less of the cravings, but they still occur. So what do you suggest for that?
You can find replacements for everything. So, for example, if you have something, like if you have a craving for something salty and crunchy, well, how about a celery stick sprinkled with sea salt, or putting almond butter on the celery stick, or a green apple with almond butter. That typically helps with the crunchy and the salty. On the sweet side, then you can freeze like fresh organic raspberries, blueberries, and just kind of crunch on those as a snack. There's literally thousands of different recipes that you can make from raw products that don't have sugar in them, that are made with xylitol or stevia, and are 100% healthy for you. I mean, I make a great raw chocolate mousse that is made with avocado and raw organic powdered cocoa and a bit of xylitol, and you just blend those together in the food processor, and you've got chocolate mousse.
Oh my gosh, that sounds amazing. So do you just do the xylitol to taste and the chocolate, the cocoa powder to taste?
There's a recipe. I don't know the ingredients off the top of my head, but I'll eventually post that recipe too.
Yeah, if you would, I would love to see it. That sounds amazing. I guess we can move on to the other essentials if you wanted to talk more about each one in a little bit more detail.
Okay. So essential number 2 has to do with reducing or eliminating your toxic exposure. And I think I mentioned this earlier, that most people start the day by putting toxins in their mouth and toxins on their body. Everything you put on your skin is absorbed in the body. So if you put any type of lotion and it's got different chemicals in it, those chemicals are going into your body. if you put anything in your mouth, even if you don't swallow it, it goes into the body. If you look on the back of the typical toothpaste that is sold commercially, you'll see in small print, if swallowed, call the Poison Control Center.
Wow.
Now, why would anybody want to put that in their mouth? And again, it's about awareness. It's about thinking and looking at, what about, the hand soap that I use? What about the cleansers that I use, to clean my countertops? Or the carpet cleaners, or the floor cleaners, or the detergents, the soaps that I use to clean my dishes. Those contain hundreds of chemicals that you're exposing your body to. Artificial fresheners, air fresheners. You get your clothes dry cleaned. There's chemicals from that. So you have to just start being aware of simple things instead of using a chemical cleaner. I grew up cleaning our windows with vinegar and water. Works extremely well. So it's just being aware of those things and eliminating or reducing your toxic exposure every day.
Huh. That makes sense. It makes perfect sense, actually.
Absolutely. Essential number 3, again, it has to do with balancing your energy. Now, your energy is... Your body is basically 1 billionth physical matter. The rest is all energy, and that came from a Nobel Prize winner back in the 60s, where he discovered and proved scientifically that we are only 1 billionth physical matter. Everything else is energy. So you want to be able to balance that energy with, whether it's through your hormones, through exercise. Sunshine is so important because there's 1,000 different wavelengths that affect our bodies in a very positive way with good sunshine. There's chiropractic studies have shown that patients that were undergoing chiropractic care over a 5-year period had a 300% stronger immune system than those that didn't. That's a huge shift. Doing things that you can do at home, like yoga and stretching and Reiki and going to get a massage. These are all things to help balance your energy.
So essential number 4 has to do with healing the emotional hurts. And there are several things that you can do without having to spend hundreds of thousands of dollars visiting a psychotherapist and taking very dangerous drugs. There are techniques that are self-help. So, for example, one of them is called EFT, or Emotional Freedom Technique. You can Google that. You can find information on my website as well. I actually have a video that helps women do EFT when it comes to healing breast cancer specifically, because there's a lot of emotional issues that come up because of breast cancer, and that can contribute to breast cancer. So Emotional Freedom Technique basically has to do with meridian tapping on the different acupuncture points on the hands and the feet, and that will help you to reduce or eliminate the emotional charge that's in the body, because we know that emotions are energy in motion, and when we can release some of that energy, then the emotions can balance themselves. And we all know that stress can accumulate in the body and can contribute to many, many diseases. Essential number 5 has to do with embracing biological dentistry. There is much research that has shown that what you put in your mouth, in your teeth, can affect your health. So, for example, a root canal. A root canal basically creates a dead entity. It's a dead tooth. So whether you have a dead gallbladder or a dead appendix in the body, we all know how sick that would make you. A dead tooth is no different. And no matter how aseptic they try to make it, there's always a pocket of anaerobic bacteria that is very, very toxic. They give off toxins that affect your immune system and the heart. And so being aware of what is going on in your mouth is important. From a meridian point of view, your teeth are directly connected to different organs. So when I was in active practice and I was doing bioenergetic testing, it was very common for me to find a tooth that had a metal filling in it, and how it was affecting a specific organ. In my case, working with breast cancer patients. So there's definitely a direct connection there. Essential number 6 has to do with rejuvenating the body with therapeutic plants.
I have a quick question for you. So, okay, should I be concerned then if I had just recently had some teeth filled for cavities? What do they typically use for those kinds of things?
The average dentist is going to use amalgams, which look silver in your mouth, in your teeth. And those amalgams contain mercury, nickel, cadmium, and other metals that are very, very toxic to the body.
Okay.
I certainly don't encourage people to have those. If you want to, there's composites now, there's porcelain, ceramics, things that they can put into the teeth that are less toxic.
Oh, okay. So I'll have to call and check what they use then.
Well, if it's is it silver?
No, I chose tooth color, so it's a white filling.
Okay. Yeah, you'd have to ask them if it's what's in what was in that filling.
Okay. I'm going to write that down. Perfect. Okay, sorry to interrupt. I know you were talking about like therapeutic plants and such. So,
no, that's fine. So the National Institute of Health stated that there are over 3,500 therapeutic plants that they personally know of that can be of benefit to the body when it comes to healing cancer. So if they know of 3,500 plants, think of, all the information that's out there that, people can access. There are literally hundreds of known cancer cures and hundreds of different plants that can have a therapeutic effect on the body when it comes to cancer. Bloodroot is one of them. So there's, there's a lot of this information is on my website. And last but not least is number 7. Essential number 7 is adopting very early detection with thermography. And thermography does not give off any radiation. It reads the infrared heat coming off the body. It can detect tumors 5 to 8 years ahead of a mammogram. Statistically, mammograms do not and have not decreased the mortality rate of breast cancer. As a matter of fact, there's much concern that the chronic exposure of radiation may actually increase breast cancer. And if there's a small tumor that is present that is not even seen on the mammogram yet, that compression with the mammogram can help spread the cancer cells in the body. So thermography is a great adjunct. I'm not telling women not to have a mammogram because I'm not allowed to say that. However, look at alternatives and look at, the relationship between all the radiation that you're getting with those mammograms that you're getting every year or twice a year sometimes.
Yeah. Well, and so it's interesting that a couple things that you talked about for me was the therapeutic plants and how there's thousands and thousands of plants that have been known to help with cancer according to the NIH. But kind of a dirty little secret with the pharmaceutical industry is, because you can't patent a plant, they're not going to market that and they're not going to spend money to do the research. But what they're going to try to find is a compound that they can make in a laboratory that looks similar to that plant compound that they can market and patent and sell to patients. I agree with you. There's, that's where pharmacy started, is with the plants, and then we went away from that and we moved to the synthetics, and the industry has just gotten into such it's a different field nowadays, and I really feel like going back to the plants is where a lot of the answers are going to be. So I'm glad you touched on that. And same thing with the mammograms. I think there was a huge controversy when they changed the recommendations and the age recommendations. But like you said, the evidence wasn't there that there was any benefit to screening early or to show the decline in mortality. So some people thought it was a conspiracy and with the economy or whatever. But I agree with you. If there was no benefit, why do we need to expose people to the effects of it earlier on? So I'm glad that you include these essentials in your practice.
Well, very good. Thank you.
Okay, well, you've covered a lot of information in this time here, and some of it, I'm sure our listeners will have a lot more questions. So how can they get more information about what you talked about today?
The best place to go would be to my website, and that's breastcancerconqueror.com. There you can see the different, the 7 essentials are all outlined there. I'm in the process of writing ebooks on all the 7 essentials. However, there are ebooks that are available now. One is on thermography and versus mammography, which has a lot of detailed studies done and research there. The other book is on cell phone radiation and the effects on breast cancer, or just EMFs in general, rather. And that's one of the things we didn't really talk about, but electropollution is definitely a major toxin that women need to be aware of. And then the third ebook has to do with healing the emotional hurts, where I just discuss EFT and different emotional techniques to help heal the body emotionally. There's also a free book that you can get that is called The 7 Essentials to Healing and Preventing Breast Cancer, just by signing up for the newsletter or visiting the website. And I also offer for women that are looking for alternative methods or who just want to be more proactive with prevention, I do offer a free initial consultation to discuss what their healthcare needs are. And after that, if they're interested, I also offer coaching and tutoring for people who really want to get serious about healing their body and moving in that direction.
So, and they can find more about your coaching program on your website as well?
Absolutely. breastcancerconqueror.com.
Okay, great. Well, thank you so much, Dr. V, for spending your morning with us and, telling us some more information about your 7 essentials in more detail. You are such a wealth of knowledge. I mean, with your years of experience and just what your experiences are in overcoming and conquering breast cancer, you have a lot to offer to people, and your story is just truly inspiring, and I can tell, how passionate you are about what you do and how you care about people. So I really hope that our listeners take advantage of the ebooks on your website and get in touch with you with the free consultation. So, because I think they can really benefit from what you have to offer.
Thank you, Anne. Thank you so much for taking the time and for sharing this important message that I feel is so vital for women to hear. So thank you for considering me.
Hey, so I hope you enjoyed the show. That was Dr. V from breastcancerconqueror.com. All the links and resources mentioned today are in the show notes at drann.com/002. And Ann is spelled ANH as in hieroglyphics. While you're there, remember to jump on the Food as Medicine VIP email list, and you'll get my free gift, the Clean Eating Rules. It's my #1 guide for how to eat to lose weight, improve your biometrics, and get more energy. You'll also get my favorite pearls from the show, because if you're anything like me, you're probably listening to this while driving, doing your laundry, or just cleaning, and you really can't be jotting down notes of all the great information that's shared in the episode. So I've taken the notes for you, and by hopping on my email list, you'll get the show pearls. Finally, as a VIP email subscriber, you'll get the occasional love letters from me, which are emails sharing some of my favorite recipes and products, upcoming events, new information I've learned, and other goodies. So go to drann.com now and enter your name and email address. If you like this interview, be sure to subscribe to the show so you get all the new episodes. We've got plenty of great guests coming up, so stay tuned. Thanks so much for stopping by, and until next time, remember to eat consciously, because the world needs a healthy and vibrant you.
If you like this video, be sure to subscribe to this channel and share it with your friends, because we need more people to hear the Food is Medicine message. And make sure to head over to drann.com and sign up for free updates, because I share some insights in my email updates that I don't share anywhere else. And before you go, don't forget to leave a comment, because I absolutely love hearing from you.